Okay. Well, thanks, everybody. Thank you for showing up tonight for our Monday town hall on coronavirus. I'm Bob Griffin. I'm the Dean of the College of Emergency Preparedness, Homeland Security, and Cybersecurity, which will be the last time I say that full name tonight. CEHC it will do. And thank you for everybody who joined us on tonight's panel. I'm especially pleased to announce that our President Havidan Rodriguez is here. He's going to give us an update on what's occurring at the university, but also work that the university has been doing with our other partners. Dean Holtgrave from the School of Public Health is going to give us an update on the public health aspects of coronavirus. And I'm really pleased to announce that Dean Lynn Warner is going to be here from the Dean of the School of Social Welfare. And Dean Warner is going to start to talk about what I think is going to be a incredibly important and pressing societal issue when we start to think about the area of mental health in our communities. So I'd like to turn it over to the president, and then we'll of course take your questions and answers. And as always, if you use the Q&A function, which is located right there on the bottom of your Zoom bar, we have faculty and staff standing by to answer your questions. So that's been a great feature. So behind us is a whole set of faculty that are ready to jump in with you. And again, for all of our students that are here, thank you for participating and staying connected with the university. President Rodriguez, would you like to say a few words?
Sure. First and foremost, good evening to everyone. Thank you so very much for joining us in this town hall. Dean Griffin and Dean David Holtgrave, thank you so very much for your leadership in launching these town halls. I need to say that these two deans and their corresponding colleges represent a significant part of the reason why UAlbany has an important role to play in this pandemic. And also thanks to Dean Lynn Warner for being part of the conversation tonight. The School of Social Welfare also plays a significant role in terms of the far-reaching impacts of COVID-19 and their impact on the mental health of our communities. As president, I must say that we are truly fortunate to have a globally leading academic and research programs in the areas of public health, emergency preparedness, social welfare, public policy, psychology, among many other fields that allow us to play a very important role in our response to this pandemic. As a Research One university, there has never been a more critical time to marshal our resources and our expertise to really serve the greater good. This is another way that we, as the university at Albany, are truly embodying our core priorities of research excellence and engagement in service. I must say that as president of UAlbany, I am extremely proud of the work, engagement, and response of our university community. For example, what we're doing here tonight, right now, through these town halls, sharing important updates and information with our communities is extremely important. Also, CEHC, the College of Emergency Preparedness, Homeland Security, and Cybersecurity, and the College of Engineering and Applied Sciences are manufacturing medical grade face shields for local hospitals using 3D printers, including in faculty members' homes and students' homes. The School of Public Health, and the Dean is with us tonight, has been tapped to help with 2 state-led studies examining potential drug treatments for COVID-19. And UAlbany is going to be one of the New York State Department of Health leading academic partners on this study. Faculty members, staff, and alumni, including alumni from Taiwan, have donated gloves and masks and other materials for use in our hospitals and in other settings. The School of Education is hosting community conversations, which are virtual open discussions for K-12 teachers and leaders focusing on equity and remote learning. And just this past Saturday, we held, our 3rd annual big event. And this time it was virtually with great participation from our community and dozens of volunteer initiatives across this region. And today in partnership with the state of New York, Governor Cuomo, the Department of Health, the Department of Homeland Security and Emergency Services, we opened a COVID-19 testing site on our Colonial Quad. It is truly an honor to be able to support our community by hosting this critical facility. As you all know, one of the key factors to reducing the spread of COVID-19 is through testing. And so that the university now is actively contributing to this process is also incredibly important. And as many of you know that are joining us today, as an institution of higher education, we have collectively tackled some major hurdles and have made some significant and very difficult decisions to ensure the health, the safety, and well-being of our community. Almost overnight, we stood up a strong system of remote teaching, learning, and working, which seems to be working quite well thus far. We have maintained minimal essential staff on our 3 campuses. Also, while trying to be compassionate and understanding, we allowed only students that met any of our 3 extenuating circumstances to remain in their residence halls. We also had to postpone commencement, which was a very difficult and emotional decision for all of us to make. And we also have been quite innovative with teleadvising, telecounseling, telehealth. We just did our first ever virtual open house, which was extremely successful, and the participation was extraordinary. And, you know, as an institution of higher education, we continue to monitor the short and long-term impacts of COVID-19 on our communities and on UAlbany itself. So again, I would like to take this opportunity to thank our faculty, our staff, our students, our leadership team, our COVID-19 task force, our alumni, for everything they have done to make it possible, not only for us to adapt, but to effectively respond to this fast changing situation. And I must say that one of the best ways to ensure our continued impact, our collective impact, is our ongoing focus on communication and collaboration, and to share information, including our publicly engaged research, scholarship, and expertise. And I also ask our community, our internal and external community, that we continue to maintain our focus on effective leadership, flexibility, empathy, and patience. Let me just conclude by saying that our heart truly goes out to those individuals and their families that have been tested as positive, COVID-19 positive. And we are also heartbroken by the increasing number of deaths as a result of this pandemic. But we also want to thank our first responders, our healthcare professionals, our elected officials for the excellent work they're doing in combating COVID-19 and trying to reduce the spread of this virus. So to all of you that are working to help protect us while putting your lives at risk, as we say in Spanish, muchísimas gracias. Thank you so very much for everything that you are doing. And thank you for being part of this collective effort to protect our communities and to reduce the spread of COVID-19. Once again, Bob and David, thank you so very much for the opportunity to be here with you this evening, and I look forward to our remaining conversation.
Hear that, I just want everybody to know before you write in, we did not coordinate our outfits tonight. Dean Holtgrave, would you like to give a quick update on the public health impacts of COVID, the pandemic?
Great, I would be happy to. And Dean Griffin, Dean Warner, President Rodriguez, it's a real pleasure to be with all of you this evening. And I also wanted to extend my thanks to the faculty, staff, and students of School of Public Health and CEHC and SSW and all across the university for everything that all of you are doing to address this global pandemic. It's really amazing to see all of the incredible contributions that are being made. I just will make a couple of points quickly. The first is every week we start off by hitting a few of the numbers, and I know that many of you have seen these and know these, but I think it's worth just kind of orienting our discussion with what's the scope of the pandemic. And so globally, we're now at 1.3 million cases of COVID-19, 73,000 deaths. In the United States, about 353,000 cases of COVID-19 and about 10,000 deaths. We crossed that threshold today. In New York State, I wanted to refer you to a new important resource. It's a website that the State Department of Health has put together. It's called COVID19tracker.health.ny.gov, COVID19tracker.health.ny.gov. And a couple of times a day, they update it with most recent statistics on testing, number of cases, and so on. It's a really tremendously useful site by county level. And also, I think increasingly people are quite worried about the health disparities that we are beginning to see by looking at gender and age and race, ethnicity, yes, that's actually the site. Thank you very much, Matt, for finding that and sharing that right away. And so I think this website is starting to report by some of those demographic characteristics, and it's going to be very important that we monitor these health disparities and find ways to address them and build health equity. So it's a start. But here in New York State, we're at about 131,000 cases, just a little under that. Out of 321,000 tests for a positivity rate of about 40.7%. And in the last day, there's been about 8,658 cases out of 18,531 tests for about a 46% positivity. And I always mention that in these town halls because as long as that positivity rate is that high, it means that mainly the testing is diagnostic in nature, and it's not as community-wide as we would need to be able to understand where the front end of the epidemic is. And I think it's really important the kind of drive-through testing that's now being offered at the University of Albany that will play a critical role. And in just a few days, it will be able to expand several-fold the numbers of tests that are being done here at Albany. So I think that's a tremendous contribution. The number of deaths that we've seen so far in New York State is about 4,758. That's up about 600 from yesterday. And for about the last 3 days running, it's about 600 a day, give or take. So it's been flattening off a little bit. I think the question now for New York State, and the governor brought this up in the press conference today, are we beginning to reach the apex of numbers of deaths? But instead of going up quickly and then down, are we going to see a high level flat plateau and be there for a while? And that's a possibility that we will have reached this top, and that mainly what may be happening, and the governor spoke of this today in his press conference, we're hitting kind of the capacity of the healthcare system. And as we do that, the capacity of the healthcare system may start to drive the numbers. So rather than the epi drive the numbers, you may see the capacity of the system start to drive the numbers. And if that's the case, we may be at this apex, which becomes a high level plateau for a number of days or a couple of weeks. We'll see. In New York City, 72,000 cases of about 140,000 tests, so just over 50% positivity. And in the last 24 hours, it's been about a 57% positivity, so very high. And again, a function of testing availability. Here in Albany, it has been about 319 cases out of 4,200 tests for about a 7.5% positivity. In the last day, it was about 14 cases out of 89 tests for about 15%. So this, again, this idea of doing more in the way of drive-through testing is critically important and tremendous. So I wanted to just kind of orient us with those numbers again, and just a reminder of kind of the stakes of everything that we're all collectively responding to and addressing. And the last 3 points I want to make very, very quickly are, one, I think it's useful to provide an update if there's a new emerging area of science or differing policy, and that's around the recommendations about wearing masks in public. Early on, the CDC was focusing on masks for healthcare workers and persons who were positive for coronavirus. Now have said they encourage everyone to do that. And I think in large part, they're assuming that a substantial number of people may have asymptomatic transmission. Maybe it's 25%, maybe it's more than that. But if you have asymptomatic coronavirus and you haven't yet been tested, you don't know that you're positive, it's easy to transmit perhaps to someone else unwittingly, unknowingly. And if we're all wearing masks, we sort of all pretend that we're asymptomatic cases, which of course is not true. But if we pretend that to be the case and all wear masks, that will help disrupt some of that symptomatic transmission. So masks, especially the kind of loose fitting cloth kind of masks that are being talked about, or wearing a bandana, are probably less good at helping you prevent yourself from becoming infected if you're negative. But if you happen to be an asymptomatic person living with coronavirus, it might help you to avoid asymptomatic transmission. So that's been a shift in thinking recently. Also, just as the president mentioned earlier, we're very involved in these studies of hydroxychloroquine, azithromycin, and chloroquine. The study we're most involved in is a very quick observational study. We hope yet in April we will have some results from this study where we're looking at three things. One is naturally occurring prescribing patterns of physicians. How much are they using these drugs or not? Secondly, what are the side effects that we're seeing, especially cardiac side effects, because these drugs might disrupt the QT fraction of cardiac functioning, and so that's important to keep an eye on. And then do we see any initial early signs of impact on length of stay in hospital, need to be in the ICU, need to be intubated, or fatality rates? And so that's moving along very quickly. Last week, we got IRB approval. We sent in our first request for medical records. These are all medical record review study. The first round of those medical records are being pulled now. So it's moving along quite rapidly. And the last thing I just want to close with is on March 31st, the day after we had our last town hall, Dr. Anthony Fauci from NIH on one of the White House press briefings said, the models were suggesting for the U.S. that we might peak out this summer at somewhere between 100,000 to 200,000 COVID-19 deaths. And Dr. Fauci said we need to be prepared for that as a reality, but we don't have to accept that as a reality. And we have to constantly be challenging ourselves to find ways to change that reality. So even though that's what the models say, even though that seems realistic given the data that we've seen so far, there's things we can do. And I think it's really important, something that we can all do is to continue to make sure that we're making the most of physical distancing. And Dr. Sanjay Gupta from CNN said it's important that people not look for loopholes in physical distancing, but rather look for ways to be as complete as we can in trying to distance ourselves from other people while we maintain our social connections through connections like Zoom here tonight. And I just wanted to say that again, because I think in all the things we're doing, the printing of 3D masks, the drive-through testing, the studies of hydroxychloroquine, the volunteering in different county health departments, all of the things that people are doing are making an enormous difference in not accepting that reality. And I just thought that was an important sentiment that Dr. Fauci expressed last week. And I just wanted to share that this evening. So let me stop there. And Dean Griffin, I'll turn it back to you.
Thanks, Dean Holtgrave. Appreciate everything that you're doing. I'd like to now introduce Dean Lynn Warner for the School of Social Welfare. Dean Warner, thank you for being with us tonight. I think that you're going to shoulder a heck of a burden from this pandemic, and I know I can speak for CEHC and public health, and that we stand with you, and we're really glad that you're part of the team. Dean Warner.
Thanks. Thank you, Bob. It's really wonderful to be here, and I appreciate the invitation so much. I know that my colleagues at CEHC and public health share the belief that our areas of expertise really have to be brought to bear collectively to both educate the students of today to solve tomorrow's problems, but most importantly, to work together right now to recover from the current public health crisis. I appreciate the sentiment that as the duration of the pandemic endures, and with all due respect to everything that we are all doing to survive and adapt as productively as possible, we know that this is an unprecedented disruption to our society, our social systems, our economy, and that the road to recovery, I think, is going to require us all to really be devoted for the long term and together. So I really appreciate having a chance to be here to highlight a couple of the things that I'm particularly concerned about at the moment. Perhaps at another session, I'll talk about the things that the School of Social Welfare is doing and could be doing more broadly in terms of recovery. But for tonight, I really wanted to focus more on an area that has been my own area of expertise and research over the vast course of my career, which is as an educator and a researcher in the area of addictions and mental health. And in particular in inequities in the rates of mental health and substance disorder, and also inequities in access to services. I think that I know that I've appreciate the fact that the town hall is really structured to give people a chance for questions and answers. So I'm going to try to be brief in highlighting some of what we anticipate some of the immediate and shorter term impacts of our adaptation to COVID are going to be, and have a chance to really hear from the audience about what some of their thoughts and concerns are so that we can engage in a dialogue around that. But before I dive into the bulk of my talk, my few moments, I do want to, as any good academic will do, I want to read a definition. And it's a definition of mental health from the World Health Organization, because I think some of the key components in this definition will really help us understand the tremendous concerns that we really should have about the steps that we're taking or not taking in terms of addressing the pandemic right now. So according to the World Health Organization, mental health is a state of well-being in which a person realizes his or her own abilities, can cope with normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So I think the first thing to recognize in that definition is that mental health is a condition relative to normal stresses of life. And I think that we could all, there's no debate that what we're experiencing right now is not a normal stressor. And so as we think about our general population, all of us together, we have been asked to change the way we live our lives, and we've been asked to do it in rapid fire. So the amount of stress that goes along with that is certainly something that we are, if you're anything like me and my email and my social networks, we are all sharing information about how to manage this stress these days, how to manage our anxiety. And this is absolutely a first step, a frontline, everything that we should all be paying attention to. It's no surprise that today one of the other initiatives that the governor announced was the New York State of Mind, a free meditation and mindfulness content hub curated for New Yorkers. So there's an acknowledgement both from not only from researchers who've studied mental health and managing anxiety, but also policymakers know that there need to be resources for people to understand, to take advantage of, ways that we can manage this inordinate level of stress that we're experiencing. Another key component of that definition of mental health is working productively and fruitfully. So many of us have the luxury of being able to work remotely, and however stressful that transition was to begin to work remotely, it's been quite remarkable how well we have all managed it. We know that's happened at the university with faculty members doing what they need to do to get resources and training and coaching to move things remotely. Whether or not we all feel that what we are able to do remotely is as productive or as effective as we have become accustomed to feeling, is another thread that all of us will need to be paying attention to. It creates its own level of stress to not be functioning to the level that we know we can. The other piece of the definition is making a contribution to his or her community. Again, we know there are lots of virtual ways that people are working together and trying to maintain that sense of social connectedness despite the physical distancing that we're all expected to adhere to. So a couple of things that the physical distancing, though, is going to generate, in addition to keeping us healthy in terms of limiting the transmission of COVID, which is absolutely a priority, it is also taking its toll on the extent to which we do interact with each other around really meaningful life events. And when we think about things like all of the events that we've had to cancel or postpone, or however effectively we've moved them to virtual environments, people are experiencing low levels to high levels of loss and grief because of not being able to celebrate and be with people the way they had planned to. This is particularly important for those of us who have loved ones who are ill and who are in the hospital and who we can't visit because it's not safe in terms of potential risk of transmission. So as people who would be in a situation of experiencing loss and death of loved ones anyway would be needing to find ways to grieve those losses. The extent to which we want to be thinking about finding other avenues and supports for grieving, I think will be exponentially greater now that we have not only more people who are dying, but also more people who are dying alone, and who those survivors who are left may be feeling quite guilty that they weren't able to be there and to support their loved ones at the end. Those couple of things, I guess I would like to sort of make a caveat that I'm talking about in general, the general population, people who don't already have pre-existing mental health or substance abuse conditions we are all going to be stressed in ways, and we're all going to have to find ways to improve our resilience and our coping strategies. I think it's also important to acknowledge that human nature often inspires us to seek substances when we're looking for coping mechanisms. So the use of alcohol and other drugs is not something uncommon in our society to begin with. We have high rates of alcohol use disorder in the United States, regardless of a pandemic. And I think that it is important for us to acknowledge that as another risk of social isolation is that people who are inclined to seek substances as a way to cope might have less parameters that will restrict them from using heavily, or from using, maybe they are daily drinkers who are now, because they are at home all day, are drinking earlier in the day. Though these are sort of things that we know that public health and mental health and other experts are increasingly just trying to send out, notices, be paying attention. You should all be we all need to be vigilant of our own practices and behaviors as we implement our coping attempts. I think it's interesting that one of the early virtual experiences that was kind of going viral was the virtual happy hour. Again, not unexpected. That's sort of what a lot of life is about. Happy hour on Fridays. Nothing wrong with that, but I think it would be important to also be cognizant that for many individuals, it would be also helpful to acknowledge that it might be a virtual get-together, cocktails or not, to remind us that there are people for whom the vulnerability for alcohol and alcohol abuse is actually quite high in the US overall. I think, as I mentioned, there are also people who have pre-existing mental health and substance abuse issues for whom this particular time is going to be extra challenging. They may already be connected to services, whether it's, again, mental health or substance abuse formal services. We have seen tremendous ability of our providers to start delivering care and services remotely. Telehealth, for example, is increasing in use, and many agencies are really able to maintain their caseloads in that way, but many are not. Many of the more poorly resourced nonprofit organizations, for example, who would normally be providing a lot of these services are not yet well equipped to provide that level of care for people with mental health and substance abuse services. It remains a question as to whether or not the informal supports that are available for people with substance abuse, such as Alcoholics Anonymous, those kinds of services. There are some people, again, who are kind of readily versed and capable and comfortable in connecting virtually for those kinds of support services, but it remains an open question and will be an important area, I think, for research to see how well those services are received by many, and if there are some people who maybe lose connection to their service providers because of their own personal discomfort with trying to interact in that virtual way. And then I guess the other group of people, as we think about sort of near-term and short-term concerns as the pandemic resolves, we hope, in the next several weeks, is those people whose past life experiences are put them at higher risk for either not having the kinds of resources that are needed in these times of isolation and distance, or whose life experiences really have been replete with other adverse experiences or trauma before this. So as if many of you may have heard of the term adverse childhood experiences, or early traumatic experiences, traumatic events. This is just as 9/11 or Katrina or other natural disasters, when we know from research in those events that kind of the level of exposure that a person with prior traumatic experiences has will magnify their risk for exacerbating either their symptoms of mental health or their tendency to resort to coping with substances in a way that is not going to be as helpful to them as they would have hoped. So as we think about the steps that individuals may need to be taking to be prepared to support their own loved ones, it will be really important to check in very frequently around access to not only the basic needs, food, warmth, safety, but to make sure that their thoughts about how that they are choosing to manage this stressful time are being handled. And we can do that with our social circles, but as a community and as we look to kind of longer term, and when I say longer term, I'm thinking about the next few months, impacts. We know that the stressors that families are going to be experiencing with the lack of consistent contacts with healthcare providers, with unemployment, with incomes that have already, for many communities, been far below what families need to survive, that those communities are going to need our more intensive attention as we start thinking about how are we going to be a resilient society moving forward. And I'll just give a little bit of a plug for all of the people who are working in the policy arena right now to think about what are those more universal social service programs that we might think about wanting to advocate for in terms of the importance of them being available, so that as the hugely destabilizing not only health but economic implications of COVID take place, that there isn't a further reinforcing of an us versus them in terms of who has access to some things and who doesn't. So if there's universal health care, if there's a livable wage for all people, if there are universal social services and social system responses, that I think that will position us to, as a society, to attend in a universal way to all of the mental health risks that we are going to be seeing, as opposed to continuing what we've been doing in the past, which is piecemeal, identifying a problem and trying to put some parameters around this small limited group of people who we think might need some attention for it. So I think I might have gone over my 5 minutes, but I hope that there's still plenty of time to talk about these, some of the ideas that others might have about how we can look forward to being a resilient society.
Great, thank you so much, Dean Warner. I appreciate all of the comments, and you made the comment that disasters really lay bare existing inequalities, and I think that's going to be particularly true for this situation. A couple of points before we open the floor up to questions and answers. Again, if you submit your questions and answers in the Q&A area of the Zoom, we've got faculty and staff that are there to also help answer your questions. I was also remiss to remind everybody this sort of basic credo that practice not only acts of kindness, hate the virus, but not the people. We are hearing more reports of particular groups being targeted unfairly, and it's something that none of us can tolerate. So again, hate the virus, love the people. With that said, I'm also going to introduce, Provost Carol Kim is here to also help with questions, as are Vice Dean Mary Gallant from the School of Public Health, and of course, Vice Dean Jen Goodall from CEHC. So why don't we start to get to some of the questions? Jen, do we have any questions?
We do. So a bunch of questions have been answered. So those are listed in the answers and you can see there's been a conversation going. One question that we still have, based on messages from nurses that I know, it seemed to me that many of our healthcare providers will need to be treated for PTSD. These are professionals that have never experienced something like this after decades of treating patients. How will we approach this huge need?
Lynn, do you want to take a whack at it first?
Yeah, so I think absolutely the first responders, nurses, doctors who are being challenged in ways that none of us would have imagined certainly need right now extra attention in terms of making sure that they are able to the greatest extent possible to take care of their own personal needs to the extent that they can rest, have shifts, have contact with their families, things that need to be put in place now so that they aren't depleted unnecessarily, which is, in some of these situations, I think almost impossible to try to think about how that would happen. I think it's also important to be a little bit careful with the terminology here in terms of for example, making sure that people who have been faced with these levels of stress and also being asked to make decisions that are outside the norm of what they've been trained to do. As we increasingly hear about, at least in the city, some decisions around rationing care that is so anathema to the way doctors and nurses have been prepared to deliver their care is just a cognitive dissonance that is going to need really expert intervention for those people in particular. Jumping to a diagnosis of post-traumatic stress disorder, I think, is something that I would again suggest that what we need to do is anticipate that, yes, in fact, these people are being asked to do things that are so outside the norm. And so we need to put things in place right now as they are doing their jobs and as they're not only as they're doing their jobs now, but as we think about the supports that we can put around them when the pandemic does begin to ebb and their kind of normal life begins to come back into place. It would be important to intervene early with supports, suggestions for counseling for anyone who would want it. I would hope that would not be costly personally to them, that there would be supports for counseling that they could avail themselves of confidentially and at minimal to no cost to themselves. And that early intervention and early attention would hopefully prevent the ultimate development of an actual diagnosis of post-traumatic stress disorder, which if it got to that point would mean that those early intervention steps had not been successful. So, yeah.
Dean Ward, thank you. I'm just going to make a personal note. I can tell you that after 9/11, the pressure as a first responder who responded into the Pentagon is absolutely tremendous. And for those of you that know someone working in this environment, whether it's in the healthcare industry or as a first responder in public health, this is where random acts of kindness actually make a really big difference. And they don't have to be big things, but when the weather approves, if your neighbor needs a lawn cut, or just checking in to see if people are doing okay. If it's one of your loved ones, make sure that you're there for support. I mean, what got me through was my amazing wife and family being patient with me. We didn't know as much about the stress as we do now. And the comment that I think Dean Warner made about counseling is absolutely spot on. And remember too, as students and staff and faculty who are on, don't forget the great services we have on campus. And please, 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 more than anything else, when you're comfortable, don't be afraid to talk about it. We've got services all across all across the university that are there to work with you. So please take that seriously. I don't know if anybody else wanted to make any comments as far as that's concerned. Okay. Jed, how about another question?
Sure. The next question is for Provost Kim. Some of our students have family members testing positive for coronavirus. Others close friends having lost family members. What academic accommodations should we make for these students?
Hi, everyone, and thank you for the question. That's a great question. We want to provide flexibility and accommodations for these students, but of course there are, we want to treat these situations also very similarly to the way we would accommodate students in any other time as well. So, you know, students, if they lose family, we accommodate them. If they're feeling tons of stress because of the situation we're in, which is a little bit different from what we normally see, we're trying to include some flexibility in how we can accommodate students. It's going to be case by case, but certainly if students have lost family members, we would accommodate as we normally would. So, yes.
Thanks very much, Provost. And remember too that, again, there are lots of services on campus. And so whether it's the Dean of Undergraduate Education, whether it's the Dean of Students, whether it's Provost's office, whether it's our own mental health folks, there are lots of services available. And then the other piece of it is collectively as a community, we need to really help each other. Jen, do you have some other questions for us?
We do. A student asks, having studied situations such as these in CEHC and public health, many students want to know how to get involved or how to help with the situation at hand. Everyone is told that we should stay home, but it's difficult for students who are looking to get into these fields to just stay put. To those who study this, the situation at hand seems like the perfect opportunity to get involved and get valuable experience. How can students help out and get involved?
David, do you want to take a first jump at that?
Sure, I'd be happy to. It's a great question. And for students in the School of Public Health, I think it's important to mention that Janine Jerkowski, Dr. Jerkowski, who's really doing tremendous work on community engagement, is a great first point of contact. So if you're a student in the school, you're interested in getting involved, if you could send please an email to Dr. Jerkowski and let her know the amount of time you have available to devote, the types of things you're interested in doing, whether they're things you'd like to do from your home or things that you might be interested in. If a health department, for instance, had some work that they needed to be done. And I think that that is a great first step for us. And I think that it's important, as you highlight, in some cases, the work that needs to be done, one has to go out like the volunteers who've come forward to help with standing up the drive-through testing at University at Albany. Some of that work needs to be done in the field. On the other hand, there's a lot of work that one can do when you're physically distancing as well, too. Health departments, a number of people doing studies in different areas have data that has to be analyzed very quickly, information that can be gathered from different data sets that are available online. So I think there are things that we can do in the field, but also things that we can do from our homes or apartments while we're physically distancing as well too. But please let Dr. Jerkowski know. But I'm sure Dean Warner and Dean Griffin have other answers for SSW and CEHC as well too.
Dean Warner, would you like to comment?
Yeah, I think one of the things, as Dean Holtgrave said, oftentimes our normal inclination right now is to go to where people need help because of the physical distancing, that initial impulse has to be checked. But that doesn't mean that there aren't a lot of other opportunities to check in with people, and I think that in fact is one of the key aspects of minimizing the social isolation that many people are feeling in this physical distance environment. So there are different opportunities for people students to get involved with phone calls, for example, mental health check-ins. There is the Office of Mental Health has been developing a volunteer portal, which if I might have to send that to you separately after this, for people who are interested in doing some online brief check-ins, not at the level of mental health counseling, but again, acknowledging that the checking in with people is an important opportunity. I think as the needs for volunteers is going to only increase as the restrictions on physical distancing lift, when we realize the amount of resources that people are going to need to meet their basic needs. So anything related to food delivery, Meals on Wheels, those kinds of basic needs are not going to diminish in the near future. So it would be important to continue to look for those opportunities as the opportunity to actually be physically present arise.
And Bob, if I may add,
Sure, President.
you know, what our colleagues said from their respective colleges, schools and colleges, is also true across all the colleges and schools across the university at Albany. And so there are many, many opportunities, both academically and in terms of some of the initiatives that Dean Warner just mentioned. For example, as I had initially mentioned in my introductory comments, this past Saturday, we had the big event at the University at Albany, which is a community engagement and service, engaging our faculty, staff, and students in providing services throughout the community. And there were dozens and dozens of volunteer opportunities which still exist today at the university. And so through our student affairs side, we're doing quite a lot of work through our website to connect the needs of organizations, community organizations, nonprofits, to the services that our faculty, staff, and especially our students can provide. So again, there's many, many opportunities for you to collaborate, provide your services, albeit virtually, right? Because at the end of the day, first and foremost, is the safety and health of our students and our faculty and our staff that we must put at the forefront. But even then, there are many, many things that you can contribute through these virtual experiences and by volunteering through all these initiatives that we have at the university.
Yeah, thank you for that. To sort of add on to that, if you're a CEHC student and you're interested in volunteering, if you just drop us an email at cehc@albany.edu, we'll keep that as part of our database. I want to remind folks that this is going to be a marathon. This isn't a sprint, and it's going to go in different waves of need and support. Right now, we have our students are actively involved in the 3D printing of personal protective equipment. We're doing that in conjunction and cooperation with our School of Engineering. If you have 3D printers and you're interested in getting involved, just drop us a line and let us know. We have our volunteer operations support team, which is monitoring social media on behalf of the state Division of Homeland Security Emergency Services. So there are ways to get involved. Like I said, drop us a line, and we'll keep it. We'll keep your name, and we'll try to connect you as best we can. I'll go back to what the president said, though, because it's I think critically important, is that those random acts of kindness, the empathy that the president has talked about on multiple occasions, is so critically important right now. And even little things like in the past where you may have been short with somebody, or you may not have stopped to offer a hand, now is an opportunity virtually to offer a hand and get involved. So thank you for being Great Danes and helping us protect the pack. That's what we do. How about I think we have time for one more question.
If we have time for one more, then I'm going to put two of them together.
We have
So
time
one
for
half
two
of
questions
it
in one.
is, will the virus return in the fall and winter? And the other half is, any specific factors that have been identified as reasons why U.S. has seen the highest number of cases? Has there been total clarity about this, or is there any ambiguity?
Dean Holtgrave.
Well, I'll start, and others may want to add to this. I think the issue with regard to whether or not, or why I should say, that we've had the highest number of cases. Of course, there is always some ambiguity in a naturally unfolding event like this pandemic, but I think one of the very leading theories that has a lot of credibility to it is that the United States got off to a slow start with regard to testing. Testing rolled out in a way that was a bit slower than one would have liked. There were some problems with the initial tests. They had to kind of be restarted. And now we're starting to see the development of some other kinds of tests, especially rapid tests now are being used more. And even though we're doing a lot, I think there's something like 1.5 million tests, roughly speaking, have been done so far. There's more that needs to be done with the kind of positivity rate that I was talking about earlier in New York City and New York State overall. It means that testing is still basically diagnostic in nature, and we need to continue to expand testing until we have really a true community-wide sense of what's going on. So I think that's one really critical factor that we had to pay attention to. Related to that is physical distancing. I think it rolled out in different areas at different speeds with different intensity, but the more we can do there, the better as well. And then with regard to seasonality, I'll try and channel Dr. Fauci again, if I can, from NIH. I think Dr. Fauci often will say that most coronaviruses seem to have some seasonality to them. Wouldn't expect things to go away entirely over the summer. We haven't seen lots of effects of temperature on this particular coronavirus yet. But if it behaves like other coronaviruses, maybe some a downward trend in the summer, but also Dr. Fauci will say he would expect that we would see this come back again in the fall and next winter. And so the race is really on, because when it comes back, if it does, and we think that it may very well, in the fall and next winter, we want to have a different set of tools. Now our tools are testing and physical distancing and some of the other things we've been talking about tonight. But we want to make sure that we've got a treatment, whether it's hydroxychloroquine or remdesivir or any of the other things that are being looked at, whether it's an early vaccine candidate. We need to have a different armamentarium by that time. So really, time is of the essence. The race is on to develop more weapons so that if there is a second wave next fall, that we have a different way of trying to address it and trying to attack this. So let me stop there.
Great. Thank you so much, Dean Holtgrave. Being cognizant of everybody's time, I'm going to wrap for tonight. But before I do, I've got a couple of closing statements. And first is thank you to all of our panelists. President Havidan Rodriguez, thank you for being here, sir. Dean Holtgrave, as always, you terrify me, but thank you. And Dean Warder, thank you so much for adding to the breadth of discussion. One of the suggestions that was that Vice Dean Goodall made is to ask folks that are on about other topics that you would like to see in the future. What we'd like to try to do is continue to do updates from the folks that you've heard from, and then bring more disciplines in. So one of the goals is to bring somebody in to talk about the economy or jobs, which is another big issue. So we're going to be reaching out to other colleges on campus to continue to expand this group and give you an opportunity to hear from just renowned experts that are in the field. I'm going to end with this. Remember to stay safe, to stick with your schoolwork, and if you have any issues at all, don't hesitate to reach out to any of us, any of the faculty, any of the staff. I'm speaking for anyone who proudly wears the UAlbany colors, that we are here to be with you and to help you. Thank you for taking your time this evening. And remember, we're on next week at 7 o'clock on Monday. Let your friends know, especially folks that may be sitting at home and don't have the connectivity or connection back to the university. Spread the word. That's what we're here for. On behalf of the panelists and the great cooperation we've received from everybody, I want to wish you a good night and have a wonderful week and be safe. Thanks so much, everybody.